am Kainat raziq, student of MPhil Zoology from Cholistan University of Veterinary and Animal Sciences, Bahawalpur. Today I am going to present my abstract entitled Prevalence of Hepatitis B and C in District Bahawalpur. Hepatitis is basically a Greek word. Hepa means liver and titus means infection. So hepatitis is an inflammation of liver tissue. Hepatitis can be caused by viruses, bacteria, drugs, and medicines. Viral hepatitis is of 5 types: hepatitis A, hepatitis B, hepatitis C, hepatitis D, and E. Both hepatitis A and E are self-restrictive and can be cleared by body's immune system and can be caused by taking unhygienic food and drinking contaminated water. While hepatitis B is called serum hepatitis, hepatitis C is bloodborne in nature, and hepatitis D affect only those people who are already infected with hepatitis B virus. So hepatitis D is also known as superinfection. Hepatitis B virus is a DNA virus with a genome size of 3.2 kb, while HCV is an RNA virus with a genome size of 9.6 kb. Modes of transmission of the disease: both hepatitis B and C spread by direct blood transfusion, seminal and vaginal fluid, unsterilized use of a unsterilized equipment, of medical equipment, dental equipment, and barber equipment, reuse of a needles, both intravenous and intramuscular injection, physical contact with the infected person, hemodialysis, etc. There are some facts about prevalence of hepatitis B and C. Recently, WHO set a goal to eliminate the viral hepatitis by 2030. Viral hepatitis has a great death and disease burden due to liver cirrhosis and hepatocellular carcinoma. Both hepatitis B and C resulted in 1.38 million deaths annually. If we talk about the hepatitis B virus affect 257 million people, which means 3.5% of the total population of the world infected with hepatitis B virus, while 71 million people are infected with HCV, which means 1% of the total prevalent population of the world infected with hepatitis C virus. If we talk about the situation in Pakistan, 12 million people are infected with hepatitis B and C virus, which means 5% of the population of the Pakistan is suffering from hepatitis B and C, and annually 150,000 new cases are reported. There are some countries who are highly endemic for HBV and HCV. Pakistan and Egypt are highly endemic for HCV, while Somalia and Sudan are highly endemic for HBV. While, while total prevalence and total disease burden, if we see the total prevalence and total disease burden, Pakistan and Egypt contribute to 80% of the disease burden. So keeping in mind in these facts, study was planned to determine the prevalence of hepatitis B and C in Bahawalpur. To know the current disease status and various risk factors were also recognized. Blood samples were collected from the patients visiting Bahawalpur Victoria Hospital. Duration of study was 6 months from December 2021 to May 2022. Around 263 samples were collected, including 81 males and 182 females. Meanwhile, questionnaire was filled by direct interview of the patient. Patient was asked about 13 questions to determine the prevalence, to determine the estimate the reasons of hepatitis B and C in Bahawalpur. These questions were about their age, gender, previous disease history, marital status, occupation, economic status, education, hospitalization, surgery, dental treatment, barber services, needle injury, blood transfusion, and drug abuse. After collection of a sample, samples were then transferred to a lab and they were centrifuged at 3,500 rounds for 15 minutes. ICT and ELISA were the tests that were utilized to determine the positive ratio within blood samples. For this purpose, ICT kits that were utilized were standard diagnostic ink, and for ELISA, autobiodiagnostic ink were utilized. After After getting the results, statistical analysis was done using chi-square test with the help of IBM SPSS software version 22. Results shows that out of 263, 83 individual, which means 30.7% people were tested positive for hepatitis B and C, and out of 83, 67 were tested positive for hepatitis C virus, 14 were tested positive for 50, which is 5.3% for hepatitis B virus, and 2 were co-infected, which is 0.76%. However, the study show a significant association of the disease with age, which shows that middle age group were more infected with hepatitis B and C, which is 31 to 40 years old people. Um, Significant association of the disease were related to education, hospitalization, and dental treatment. In conclusion, we conclude that people who visited hospital frequently, received any medical care, including dental treatment, were illiterate, were more susceptible to infection. The study were also found that illiterate people are more infected due to the practice of unhygienic condition. The study will be helpful to implement the strict legislative measures to control the increasing infection of hepatitis B and C within Bahawalpur city and in the country as well. The result of the study will be helpful to formulate a policies and adopting a preventive measures to control the increasing incidence of hepatitis B and C. At the end, there are some references, and thank you for your attention.